Did you know tuberculosis has been around for thousands of years? It was once called consumption because it seemed to slowly eat away at the body. In 1882, Robert Koch discovered the bacteria behind tuberculosis.
13 people have contracted tuberculosis in the AP winelands in South Australia, with 700 now being screened for the disease. But what is tuberculosis?
Tuberculosis is a mycobacterial infection. It's contagious, it's spread by the respiratory route, it's inhaled. So a little bit like COVID in that sense, but unlike COVID, there's a really long lead time. So after you breathe it in, you can not be sick for several months, or in fact not at all.
Tuberculosis is a respiratory disease that is primarily transmitted through airborne particles called droplet nuclei that are released into the air when a person with active tuberculosis shouts, coughs, sneezes, or sings. So these droplet nuclei containing the bacteria are inhaled by another person who is in close contact, hence getting infected with the disease. So the signs and symptoms involve the latent tuberculosis stage, which has no symptoms and then is not contagious, and then we have the active tuberculosis. So this is characterized by night sweats, severe coughs, cough with mucus, cough with blood, chest pain, fever, weight loss, weakness, and then we have the extrapulmonary tuberculosis, which extends affecting other organs. So depending on the organs it affects, you have swollen lymph nodes, you have blood in urine, that's for renal tuberculosis, and then we have back pain, that's for spinal tuberculosis. Then it also have characterized by headaches, seizures, or confusion.
However, we see outbreaks every year. In fact, we see cases every year. There are about a little over 9,000 cases reported in 2023. We've seen an uptick since COVID, about 13 million in the U.S. living with that latent or inactive TB. So not uncommon, but yes, we get concerned when we hear these numbers.
So then, who is at risk of this tuberculosis? So we have people that are living in contact with someone having active tuberculosis. And so we also have people with weakened immune systems, such as people living with HIV, diabetes, or malnutrition, and also people who are living in crowded settings, such as the prison, the shelter, or the healthcare facilities.
TB can be prevented and controlled. There are many ways that are used in this, and they're summarized in what we call the 4 I's. The first I represents identification, and in identification we detect and screen the disease in the people who are suspected of. And if the disease is detected or found, they are categorized. We have latent and also active TB. So those with active TB, they are treated using isonizable drug, and also those who are not with latent are found with latent as isolated together with those with active TB. And then the other I represents the infection control measures, which can be administrative or environmental measures, which are put to prevent the spread of TB, e.g. Can be respiratory devices which are used to protect oneself from getting infected with TB. And then the last I represents immunization.
So why are we talking about TB today? Because awareness is the first step towards prevention.